Welcome to the Up and Up podcast, where we're here with another nonprofit bringing you new information that you may not know is here in Kokomo. I've got today the president, Sarah Kottner of Project Access. That's a little near and dear to my heart.
I know it is. You have a deep history with our organization.
And I think that you guys do amazing work. And with the healthcare that's out there, we have Healthy Indiana Plan. We have the Marketplace,
Yes.
Which, a lot of people are struggling figuring out what they can and can't do. And so I think about Project Access. I think about 9 different programs under that one roof, which is like crazy.
We have a variety of different areas.
Yeah.
But with people in this community and everywhere, being underinsured or uninsured is a huge struggle. Even people who work full time and have medical insurance often don't have vision insurance or dental insurance, and that's a struggle. It's expensive.
Mm-hmm.
So we just sort of take on the different areas that we see need. Right now, we've got a lot of requests for dental care, and we just kind of try to be flexible and meet whatever needs we see come up.
What I love about it is the fact that our local community, which is so gracious, I think about doctor donated care, where they can get the primary care physician if they don't have insurance. And there's a lot of people, let's face it, that don't qualify. HIP is 138% federal poverty level, has not changed in years. Our food stamp system is at 150% federal poverty level. So why wouldn't we adjust healthcare up to that level? And so there are some legislative issues that do affect the way and what a nonprofit's niche is in that arena. And I know I'm getting technical on you, but it really is relevant, because when you get a job as a citizen and you start making $15 an hour at 40 hours a week, you potentially are over the 138%. Now, it gets better if you have kids in the household, but you still got more mouths to feed, you still got more to do, so you probably have to pick up a second job. So there is lots of inconveniences. There's a lot of obstacles. So doctor donated care is really there for that primary care physician. But what I've also seen is, what about a specialist? You have a neurologic issue. Finding the specialists that are going to step up and do that donated care. Boy, that's a challenge, but you are up to that challenge.
It is, and we kind of fill the gap. Like you said, federal poverty level is where it's at. There's not a lot of movement there when the cost of everything else is skyrocketing. Many people spend all their money just covering, providing a home, feeding themselves. They don't have anything extra, or the parents want to make sure the children are taken care of, so they don't take care of themselves. They won't spare the extra money for themselves.
Yes.
And we try to fill that gap. Most of our programs, we actually go up to 400% of poverty level.
Oh my goodness. Now that's a lot.
We bumped that up during COVID. It was 300 before, but 400% of poverty level. So we're able to help most people in the community that don't have insurance to cover all of the different options. We have, like I said, we have the dental programs. Depending on the income, it's a sliding scale. So there is a copay that's based on their income, but it's fairly nominal compared to the cost of the dental care.
Well, and I got to speak to that, because when we talk about copays, that's typical. And what I always thought about with Project Access is the fact that you're training people how to have health insurance.
Sure.
And so that is, because, to me, there's toxic charity and then there's non-toxic charity, and Project Access is very much a non-toxic charity. You're trying to give healthcare where healthcare's due, but there is a stipend to be paid, which is a copay, which that means that we're training people up that there will be a copay in most insurance cases, even if they get group insurance.
That's a great point. Our mission is to support, educate, and provide access to health care. It's not completely a handout. In some cases, it is.
Yeah.
Some people, their income level is very minimal or non-existent, and those people don't have to pay a copay. And we update their income throughout the year and just try to help them and teach them. If someone doesn't have an ability to get online and sign up for Medicaid or HIP, we have someone on staff who can teach them how to do that. We keep a file of pretty much all the nonprofits in Kokomo that deal in healthcare or anything adjacent to it. And if it's something we can't help them with, we do our best to give them the contact of someone who can. We, with the Vision program, we recently added a partnership with the Lions Club, both here in Kokomo and in Greentown and Rocheville. And we go to almost all of the schools in Howard County, any of them that'll have us. There's only been a couple who've declined. And we do vision testing at a couple of different grade levels for the students. There's no charge for the screening in the school. It's very quick, very basic, just to get an idea if there might be further issues. Once someone is flagged as possibly having some vision issues, the school nurse sends a letter out to the parents, letting them know that they would probably want to take their child in for some vision testing, and that if they don't have the means to provide the doctor's office visit, we provide one at no charge to them through Doctor Donated Care with Dr. DeClean. Their office has been wonderful.
Yes.
We also provide free glasses if the child does need them. And we've seen a huge increase in the issues with vision in children. A large part is attributed to the distance training, having to do so much more remote training on computers. And it can be taken care of, no charge. Or if the parent has the ability, they just take them and have the visit on their own insurance, but they may just not have been aware that the student's having issues. We also have donated and redistributed durable medical equipment. Someone needs a wheelchair or a walker.
Oh, I love that.
Bathroom safety equipment.
Yes.
We have a lot of it donated. We also can provide some of it through grants that we have. And we refurbish it if it needs to be and can pass it out. We only ask if the patient stops needing it at any point, they donate it back so we can put it out to someone else. We have a huge diabetic medicine donated, and I don't necessarily say insulin anymore because so much of the diabetic management is expanded into the injectables that are more other hormone bases, and those can be extremely expensive. A lot of them run close to $1,000 a month. And we have the ability to accept any that have not been opened. If the packaging has not been opened and it's been kept appropriately, we accept the donation, we store it in a locked facility, and we have a nurse who comes in. All we need is a patient prescription, and if we have that particular medication available, we can have the nurse sign it out and just dispense it to the patient. And we have a lot of people who maybe have gaps in coverage or need something extra to get them through, and it's no charge. If they need it and we have it, we hand it out.
I think about people at the beginning of the year are starting on that deductible again, but they'll hit it towards the end of the year. So November, December, they probably don't need anything. It's going to be covered, and then they're just going to pay their copay. But you're right. At the beginning of the year, here comes that catastrophic deductible piece, but maybe $5,000, and then they may have to go 5 months with no insulin until they can meet that budget. So those are compensating factors that I think that you guys are absolutely great at. And the medication assistance is really important in today's world. There are a lot of meds that, the price isn't going down. It's continuing to go up. And that's something that, I think Project Access is very, very well known. What kind of hours are you keeping? Where are you at? How do people get to you?
Absolutely. We have an office in the Family Services Building at 618 South Main Street here in Kokomo. It is a locked facility, so when you walk up to the door, you ring the bell, someone will ask who you're there for and just let them know Project Access, and they'll direct you to our office. We're there Monday through Thursday from 9 a.m. till 4 p.m. I always say it's a good idea to call in advance just to make sure we haven't gone out of the office to maybe deliver something or serve at a health fair. But even if we're not there, the receptionist at Family Services can usually help give some guidance. Our website is projectaccesshoward.org. And if anyone's interested in making a donation, we do have a link on there. You can also mail a check to our office at 618 South Main Street, or we have an account at Community First Bank for donations. And
What about volunteers? Is there ever a need for volunteers? And if so, what would the duties be?
Absolutely. We have several different opportunities depending on the interest of the person. We have different committees people can serve on. We do have a board of directors that has an opening coming up at the first of the year if someone's interested, and that is a multi-year commitment. But if someone wants to help maybe with some fundraising, they can join our committee. We have a couple of different committees. Some are short-term, maybe 3 months out of the year. Fundraising, we have different events throughout the year, so someone can just focus on one event if they're good at organization, if they're good at spreading the word and getting people excited. We have some openings for filing help in the office and just answering the phone, that sort of thing. If somebody wants just a couple hours a week, maybe half a day a week or every other week to come in the office and help support our permanent staff, and we're open to if somebody has an idea for something they might work,
absolutely,
reach out to us, and we definitely are open to any ideas, and we can see what we can come up with. I can be emailed directly at scottner, COTNER, so the letter S, COTNER, at projectaccesshoward.org. That website does have more information about our different programs. Even if someone needs a medication that's not diabetic related, we do have a partnership with the local pharmacy. If someone's, like you said, the deductible at the first of the year, they aren't able to meet it, but they need their medication, we can help cover that. If for whatever reason somebody has an accident and the emergency room prescribe some medication that they aren't able to get right away, or if it's a long-term recurring medication that they need help with. There's an intake process for all of our services. There's a little bit of income information we need to gain. It's a questionnaire, so we do have an appointment to do the intake, and once you are accepted into our program, it's approved for a year. So even if you're accepted maybe for dental, and we help you with that, 6 months later, maybe you need some vision services, we can help with that, and you don't have to go through the full intake at that time.
Is there a success story that you would like to share?
I think probably the most dramatic response we get are the people who get dentures. A lot of times it's people who've struggled with their teeth for years. And we're able to get the dentures covered at low or no cost to them. We have them come back in, and the smile's infectious. They can't help being. They're so proud of their
it's
teeth.
amazing to see.
And that happens on a monthly basis. And also people who need the injectable diabetic medicine, because if someone doesn't have insurance to cover it, it's completely out of reach. So
you're saving lives, literally.
We are. I mean, when you get down to it, sometimes it's a little thing, sometimes it's a big thing. And like you said, the education on healthcare and options. A lot of times we have people that come in to get hearing aids, which we can have refurbished ones donated or a discount for out of pocket. We have people sometimes that their insurance covers it and they just don't know what their benefits are.
Right.
So we
True.
can help figure out what the benefits are and see if it's something maybe we can complement or supplement, or if it's not covered, how we can help with that. We also do adult vision. So an eye doctor visit, glasses if they're needed are covered. And we just do anything to help people understand what their current benefits are if they have them, how we can help if they don't. And I'm just really looking at hopefully one of my big projects this year coming up, because healthcare has changed so much since COVID. During COVID and then after, there's a very different need. Some needs are met now, some needs are not met. And so I really would like to collaborate with anyone who provides healthcare through a nonprofit or is an adjacent type of nonprofit. We work very closely with Family Services. We work very closely with Minority Health Alliance.
Yes.
And I would like to kind of get together and have a sit down, maybe even with some local healthcare leaders, and just discuss where's Kokomo at right now, where's Howard County at right now, what are our needs, what's well taken care of, how can we collaborate to take care of something.
Yes.
And it's sort of like the Turning Point story and the food access story of just sitting down and figuring out who does what, so we're not stepping on each other's toes,
duplicating services. We're in unity. And, one of my favorite stories from Project Access was a gentleman that went to get a stress test, didn't have insurance, so paid out of pocket to go get that, but he failed the stress test. So he came in and he was under a bit of duress because they were like, you've got some problems and we're going to need to do open heart surgery. And it was like, oh my goodness, and my heart just went out for him. And we were able to hook him up with Kokomo Cardiology. That's been so good. And at that point then he got scheduled. And you're talking about a lot of dollars, right? I mean, open heart surgery is nothing to sneeze at when you're talking about costs. They walked out of there with roughly $20,000 is all that they ended up paying. Just out of the donated care that Project Access was able to accomplish. So I give kudos to Kokomo Cardiology and the hospitals and the anesthesiologist. I mean, all of those people were willing, to come together to save a life. And, he is getting to play with his grandchildren that weren't even born then. And so those are the kinds of things that I think about when I think about Project Access. There's some amazing stories that, you guys have done some superhero type stuff, and I really compliment the doctors in the community, the hospitals, the people behind the scenes that you don't realize are just writing those bills off because they do care about our community, and it's the part that they can do.
Yeah. We've covered blood transfusions. We've covered anesthesia services. Different people have different things covered and not. So maybe part of the surgery is covered and part of it's not. We do a lot of doctor donated. We're also doing grants more to cover things out of pocket. And just figuring out the best way to help people, teach them how to help themselves in the future, what to look for, what's important in healthcare. And like you said, the doctors, Dr. Spangler at Community Howard's
oh my
wonderful.
Goodness, yes.
Some of the specialists there. We have people who have surgery through the specialists there.
Yeah.
It's pretty amazing.
It is. We are a very overcoming city. There's a lot of obstacles that can be overcome, and it's based on the niches that the nonprofits have taken on. So I really encourage the audience today that if you have concerns or questions on your health insurance, Project Access is a good place to go. Let them check out what the benefits are. A lot of people don't know even how to call that 800 number and ask for what they need to ask. And so you don't know what you don't know. And Project Access is there to help with that, whether it's medication assistance, doctor donated care. The dentists in town are amazing. They do a lot. I think about Dr. Gerald. Melissa Gerald, and the fact that, Veterans Day is coming up, and she does a big veterans dental program every year. Jones and Karan have done amazing work, and there's so many more dentists that, I could compliment right now.
Absolutely. Those are the two that are the biggest donators as far as dentures and those services, but we have a lot of other dentists here in town. Most of them are willing to do extraction.
And you can't do dentist without a lab. And so you've got Mitch Dental Lab, and you've got all kind Midwest, and you've got a lot of different dental labs that are Mooney, and they all will partner together with that dentist to make that happen. And I still have a lady today that I see out and about. And she got her, and every time she's smiling at me, and she's got her job. In fact, I think she takes care of 2 jobs, but she wasn't able to get a job until she did get her teeth.
It's big. Presentation is big. We currently have a wait list for dentures, but we did just recently get approved for a grant through Delta Dental. So we're hoping we'll be able to catch up by the end of the month, at least get people scheduled. And always reach out. We may not be able to help immediately. It might take a couple of months, but at least start the process and figure out how we can help you.
Us nonprofits are pretty resilient at trying to find a way. So once we know there's a need in the community and we see that and uncover it and we understand the need, then usually we're able to come up with some type of solution.
Absolutely. And I have to give a shout out to our office manager, Irma Jean. She is a bulldog. She will do whatever she can to figure out a way to help someone, whether it's through us or giving them a good referral. She is so passionate. She absolutely loves doing it. And
go Irma Jean. I am your kind of people.
She is just perfect for the role. She is easy to talk to. She explains things well to people. She wants to make sure they're prepared so they understand the process. And she's always happy to answer any questions. The phone number is 854-0544, of course, 765. So you can call in and talk to her. You can shoot us an email. You can look at our website if you like more information, and never be afraid to ask any questions. We're not going to turn away any questions, and we'll figure out
a way, won't we?
Absolutely.
Yeah.
We had a mother come in the other day who was getting her child set up to have Dr. DeClean donate an appointment for her child's vision. And as we got to talking to her, we found out that she hadn't had any dental care in years. She hadn't had any vision care in years. And all of their funds recently had gone to the children's health care. So we scheduled an appointment for her to do an intake for herself. So we can she doesn't have a specific need that she's having issues with, but we want to make sure there's nothing that's being missed because she hasn't had an appointment in a couple of years.
I think that's great. You're taking care of the parent as you're taking care of the child. And so it's more of a whole family effect, if you will. And so, I think Project Access is a treasure. And of course, I feel that way about a lot of the nonprofits in Kokomo. And Sarah, I want to thank you for dedicating your time, because I don't know if you know, but board presidents and board members, they're not paid to do what they do. It's a straight up volunteer job. And but we have a lot of passionate people that jump on boards, take on and champion a cause. I think about Heidi, who's behind the camera, that's a good volunteer for us at Kokomo Urban Outreach. And, we can't do it without board members. We can't do it without the volunteers. We can't do it without the passion of the Irma Jeans out there. And so I thank you, Sarah, for being a part of this
Thank you. I
podcast.
appreciate you're a huge mentor, and I've learned from you over the years back when we were on the Samaritan Caregiver Board together.
Yes.
Sherry was actually Project Access Executive Director.
At one time.
And my family has a history with Project Access. My mom was on the board about 10 years ago.
Absolutely. She was an intricate part. I couldn't have done a lot without Janet.
Don Moore was my grandfather. He was a pharmacist here in town for many, many years. And when he passed, the family set up a fund within Project Access to help cover medications, because my grandfather had a history of he never wanted anybody to go without their medication. So he always worked with parents and patients.
And you're carrying on that family tradition of the Donald Moore Fund. So I thank Janet from the bottom of my heart for all she did for me as a board member and a friend. And I thank you for helping with Project Access. It is an amazing organization. So thank you for joining us today.
Thanks for inviting me.
Thank you for joining the Up and Up podcast. Hopefully you learned something new. Now stay tuned for this message. The episode is funded by the Community Foundation of Howard County. Special thanks to the Hunt Family Fund, which was used to fund this grant. And now back to the Up and Up podcast.
Hey, I'm here today with the Up and Up podcast, where we interview one of our Up crew. What's your name?
My name's Japreece Walkup.
How old are you?
I'm 14.
And how long have you been in the program?
So about 4 years now.
4 years. And what's one of your most memorable moments in the program?
When I earned the award at the ceremony, is like working hard.
And what's your favorite type of work?
Probably like when I get on the roof and like pull the weeds out the gutters and stuff. I like doing that sometimes.
Yeah, that could be fun.
Yeah, it can.
And you make money in the program. How do you get that money?
By working. Like you work Thursday, Friday, and Mondays. Easy $20, you feel me? But it's not like dollars. Like it goes to a bank and then you cash out like it goes to the 50s, 100s, 150, 200, etc. All 50s.
And when do you cash that out?
On Wednesdays it's called a huddle.
What's one of your favorite huddles?
I don't got a favorite. All huddles are like memorable. They all teach you a lesson. So like you should all like every huddle like it deeps into your heart. So like you can understand what it means sometimes.
What's something you've bought with all your money?
I bought a lot of things with my money, but the favorite thing I bought with my money is probably like buying my family like some food. Cause one time, yeah.
Well, was that fun? Did they really like that?
Yeah, they really did like that. I got to eat. I ain't go nowhere. It was like groceries, Like I bought a whole bunch of groceries like at Walmart.
How does it make you feel to be able to provide for your family?
It made me feel good. It made me feel like I took responsibility to myself. Like made it feel like I was a leader, Like it made me feel memorable.
And what are you gonna do when you age out of the program? What's your career choice?
My career choice. So I've been looking at like all mechanic stuff. Like I'm gonna start taking all mechanic class when I get to college, and I really think it's gonna be like a good memorable thing for me because it's a good main job, and I have experience already. Cause I'm already taking classes.
What are some lessons you've learned in the program you think will help you later on in the future?
What lessons I learned? Probably speaking up for yourself. Like don't be scared to not do something. Like if you need help, ask a question. Like I can help you, and don't so the huddle. You gotta do the creed and stuff. You gotta look at people and say it. Like it's a good thing to like speak up. Like you don't gotta be shy. Like it's a good thing to like learn how to talk to people. Yeah.
What is the creed? Do you know it?
The creed? Yeah, I can say it right now if you want me to.
Sure.
I'm respectful at home, at school, at work, and to myself. I am responsible for my actions, for caring for myself, for listening and learning, for the way I treat others. I am reliable by being on time, by keeping my promises. By finishing when I started by being persistent, I am ready to work, to lead, to speak up, and solve problems in a positive way.
And what do you get to help you memorize the creed?
You get a solid $50, like a solid 50 points. You feel me?
Well, thank you. And we'll see you next time on the Up and Up podcast.
All right, thanks for having me.